Chair Hart, we're ready to go.
Good morning, everyone. My name is Jim Hart, and I'm the Chair of the Toronto Police Services Board. Welcome to the Board's Town Hall meeting, the third in a series of 4. I'd like to begin with a land acknowledgement. Although this meeting is taking place virtually, we acknowledge that the land we're on as we meet is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and now is home to many diverse First Nations, Inuit, and Métis people. The Board also acknowledges that Toronto is covered by Treaty 13, signed by the Mississaugas of the Credit, and the Williams Treaty, signed by multiple Mississaugas and Chippewa bands. Today's meeting marks the third of the 4 town halls that the Board will be holding. We've arrived here after months of a pandemic that has seen the complete upending of what we knew to be the normal way of life. COVID-19 was causing and continues to cause many people to feel stress and anxiety amidst considerable uncertainty. These feelings create a foundation that were overlaid by the tragic deaths of Ahmaud Arbery, Breonna Taylor, George Floyd, and Regis Krasinski-Paquette, and others, leading to a global conversation on policing reform, officer accountability, and the importance of applying new lenses on the issues of community safety. Toronto's not any different, and even here we've seen thousands join in demonstrations which have become commonplace the last few weeks. We've watched these protests, rallies, and artful expressions and wanted to provide an avenue for members of the public to speak directly to us, the Toronto Police Services Board. When we opened the opportunity to engage community members in an informal setting, hundreds of people registered, prompting us to extend our town halls to 4 days to allow us to hear from as many people as we possibly could. For those of you who are unable to register, we're still accepting written, audio, and video submissions on our website until the end of this week. All submissions will be compiled and shared publicly in the coming weeks. Our staff is also working diligently to ensure that we're capturing all of the advice, recommendations, and sentiments from this town hall meeting. And they will be exploring a variety of ways to share the final summary of these meetings, including digital, graphic, and online platforms. All the feedback we receive will be part of a consideration of a referred report from our June 19th meeting to our August the 18th Police Services Board meeting. Before we get started, I'd like to go through some housekeeping items. All meetings will be chaired by me alongside other board members. Over the course of the 4 days, you'll see different members joining us. Today, we have myself, Vice Chair Molnar, Councillor Ford, and I believe Councillor Nunziata will be joining us shortly. All speakers will have 3 minutes to speak. When your name is called, please be ready to begin. We recognize that this is an unprecedented and unconventional way to host a town hall meeting, but one necessitated by the current context. Should we have any technical glitches, please be patient with us. As a final comment, I want to let everyone know who is listening that we've reached out to everyone who has registered this morning. And we reached out again this morning, so we've reached out twice. For whatever reason, a number of individuals have chosen not to join us this morning, so we have a shorter list than we anticipated. But we'll be listening very intently to those who have joined us. And now, Duby, please start with the first speaker.
Thank you, Chair. Our first speaker will be Jacqueline Vincent, to be followed by Anna Horvath. Jacqueline, can you hear us?
Yes, I can.
All right, go ahead whenever you're ready.
Thank you. So my name is Jacqueline Vincent. I'm a physician in downtown Toronto. Specifically, I'm in residency training to be a psychiatrist. So I'm here to speak today in my role as a mental health care provider. And this morning, I'm thinking about the memory of Regis Krasinski-Paquette, Chantel Moore, Rodney Levi, DeAndre Campbell, Andrew Loku, Ijaz Chowdhury, and the many other people who have died at the hands of police when they were in need of crisis support and mental health support and care. I have a number of Black and racialized patients, and they are all resilient, creative, brilliant, tough people who work very hard to survive in a world that often makes it quite difficult. And I also work hard to help my patients survive. And I am so afraid that they could be one wellness check or public police stop away from death. Some of my patients expressed fear that they might be targeted by police because of being racialized, because of their mental health issues, or both. And I wish that I could tell them that they're wrong and that that's not a risk, but I can't. When I became a doctor, I took an oath to do no harm. When my profession acts as an extension of the police, I feel that I'm doing harm. When I call the police on my patients, I feel I'm doing harm. When I walk into a room to see a patient who is handcuffed to a bed surrounded by police, I am complicit in harm. I want to finish my training knowing that there is a better way to do this work, and so I ask to defund the police and dismantle this system of policing that is not reformable, and invest that huge amount of resources instead in housing for all, in education, in peer support and community-led crisis response services, in culturally competent and anti-racist trans-positive mental health care. Listen to the calls to action from Black Lives Matter, No Pride in Policing, Not Another Black Life, Doctors for Defunding the Police, and many other organizations. I believe that we're here today to hold Toronto Police accountable and also to begin to imagine a future without them. Thank you.
Thank you very much for your comments. Board members, any questions?
Good morning, Vice Chair Hart. I'm not sure if you're able to see me. This is, Chair Hart. This is Vice Chair Mulliner speaking. I have a question for Dr. Vincent.
Go right ahead.
Thank you. Thank you very much for joining us this morning, and thank you for the work that you are doing. Exceptionally important work, especially these days, and thank you for your perspective. You did not address one of the issues, and I know you probably haven't had a chance to follow the full range of issues, but you'll be familiar with body-worn cameras. This is an issue that will be coming before the board, I believe, at our August meeting. So if you have any views on the role of body-worn cameras, that would be helpful. Thank you.
Certainly. My views are that I think there is far too much of a focus on the role of body-worn cameras in decreasing deaths in police custody. I think that we've seen over and over and over again that the presence of a body-worn camera does not actually save lives. It just possibly provides us with footage, but also there's not necessarily a way to prevent people from turning off body cameras or not turning them on, and we've seen that recently as well. I think that focusing too much on that and diverting resources toward investing in body cameras is kind of a red herring and really distracts us from being able to put resources into places that would actually make a difference.
Thank you. And I'm going to just ask you a follow-up question on this, because I know that this is not going to be an issue that is, to use the expression, black and white. I think that we're going to have to struggle through the role of body-worn cameras in the context of this current moment in history. Do you have any advice on how they could be used in a way that could be an interim measure?
That's a great question. I think that if they are going to be used as an interim measure, there has to be a real level of accountability for people to actually use them, like regular auditing of footage, making them, tamper-proof so people can't turn them off. I think just making them as foolproof as possible, if that is a route that people are sort of determined to go down.
Thank you. I appreciate that's not your area of expertise, but everybody who is participating has an interesting perspective. Thank you for your work and thank you for your position today.
Thanks.
Board members, any further questions?
Mr. Chair, I just wanted to acknowledge that I'm here, Councillor Nunziata.
Welcome, Councillor Nunziata. I mentioned you'd be here shortly, so welcome. Board members, any other questions? I have one question, Jim Hart. You mentioned a couple of things in your comments. One, that you talked about dismantling the police, but you also mentioned there are circumstances when you actually call the police. So I just wanted to pursue that a little bit. Can you tell me under what circumstances you would call the police?
So this is a tension that I find really uncomfortable as a care provider and causes a lot of cognitive dissonance, not just for me, but for many of my colleagues as well. I think often we find ourselves feeling like our hands are kind of tied with what we're able to do in a situation where we might need to call for a wellness check, for example, or get a patient to come into the hospital when we're not able to find them, or when they might be having difficulty coming in themselves. Right now, sometimes the only option that we have is to involve the police, and I think my hope is that we might have other options in the future instead.
Okay, thank you very much for your comments. Board members, any final questions? Hearing none, thank you very much for taking the time to call in today. We really appreciate it.
Thank you.
Susie, can you put on the next speaker, please?
Yes, our next speaker is Anna Horvath, to be followed by Joe Kim. Anna, can you hear us?
Yes, I can. Hello.
Hi, go ahead whenever you're ready.
Okay, thank you. My name is Anna Horvath. I'm a Toronto citizen, musician, and childcare worker, and I'm extremely concerned about the systemic violence enacted by police in our city. So I'm calling in to add my voice to the call for the Toronto Police to be defunded and for that money to be redirected to community programs to build the stability and autonomy of our Black communities, Indigenous communities, and communities of color. So I'm not going to rattle off stats to you because I know that's been done already. You've heard those numbers. If you haven't listened yet, you're not going to listen to me. So I just hope that you've internalized those things already. Instead, I'm going to appeal to your humanity, if you will. When the Toronto Police interact with these communities, I wonder how they see the people they're supposedly protecting. You know, like I wonder how much thought is given to Regis Korchinski's talent for gymnastics, or Ijaz Chowdhury's 4 children, the youngest of whom is 7 years old. What sort of future do you think DeAndre Campbell was envisioning when he called for help moments before he was killed by police officers? And have you actually thought about what Devontae Miller's life will be like with the use of one eye? Have you actually thought about any of these things truly? Are you and your police force able to see the people from these communities as real, actual people and not statistics or stereotypes? I'd imagine most of you would try to respond yes to that question, but if those answers were true, why do you keep killing them? Police violence maintains colonial power and oppression. The country of Canada was built on genocide and theft, and those origins are not divorced from the prejudices of the Toronto Police Force holding today. Your police force is participating in a long, long history of violence against Black, Brown, and Indigenous peoples. And what you're going to have to do, both individually and collectively, is to think about power. The amount of power you have, how you got it, why you wanted it in the first place, and the fact that you're going to have to give it up. I have to assume you're all smart enough to see that the tide is turning, and I'm not going to name any names here because you're all complicit. We see who's slipping through the cracks and missing the resources that are sucked up by your budget and your bloated paychecks. And if we as citizens of Toronto can research these histories and begin or deepen our understanding of these structural issues, you can too. We reject Mayor Tory's calls for tax hikes and cuts to services when your police force just asked for millions of dollars to spend on body cameras that we already know don't work. We know this already. It's been tested and studied. And as Jacqueline just said, the police are unreformable. I read those studies. You can Google them. You can read them too. And frankly, it's irresponsible for you to continue to ask callers about these cameras when we all have access to the same information. So please listen to us. Please listen to Black Lives Matter TO and the myriad of community organizations that are asking for support as they try to offer security and safety to oppressed people in our so-called multicultural city. Thank you.
Thank you very much for your comments. Board members, any questions? Hearing none, thank you very much for taking the time to speak with us today. We really appreciate it.
Thank you very much.
Doobie, next speaker, please.
Our next speaker is Joe Kim, to be followed by Valerie Michaud. Joe, can you hear us?
Yes, I can. Thank you.
Go ahead whenever you're ready.
Thank you, Mr. Chair and board members, for this opportunity today. My name is Joe Kim, Communications Director for the Canadian Mental Health Association Ontario Division. I'm speaking on behalf of our CEO, who's been called away on a personal matter. Founded in 1952, our 28 local branches are part of a community-based mental health and addiction sector that provides service to about 500,000 Ontarians annually. Our services include mental health and addictions treatment, counseling, supportive housing, court diversion, and mobile crisis response. It's from this perspective that we provide the following recommendations to the Toronto Police Service, the board, and the city. A written submission has also been provided. Our first recommendation is that Toronto establish a community-based crisis center outside of the hospital setting that can support people experiencing a mental health or addictions crisis 24 hours a day, 7 days a week. A similar model exists in London, Ontario at our CMHA Middlesex branch, where people experiencing distress can call or visit a site known as the Mental Health and Addictions Crisis Center. The center is an evidence-based program that offers 24/7 walk-in support for those who don't need hospital or 911 emergency services. Staff provide assessment and counseling for immediate support and refer people to other services for ongoing non-crisis issues. Moreover, police and paramedics are permitted to take people to the crisis center rather than hospital. In 2018-19, the Crisis Center saw 10,000 visits for assessment and response. And these were people who did not need to interact with police to receive mental health or substance use supports. Our second recommendation is for the city to implement a coordinated three-tiered crisis response model that includes a 24/7 crisis line, a civilian-only mobile crisis response team, and a mobile crisis response team that includes an officer and mental health professional. The model currently exists at CMHA Peel Dufferin with Peel Regional Police. A telephone line that can deploy a mobile crisis response is vital because when the community has access to crisis services 24 hours a day, 7 days a week, then 911 no longer becomes the default option. Community members can request a civilian response when the need for mental health and addiction services is not urgent. A pair of crisis workers can conduct visits or wellness checks for those who don't present a risk of violence and look for those who don't need immediate response. Crisis workers can de-escalate the situation, assess the individual, and provide follow-up care and referrals over the phone without police involvement. The final tier is evidence-based mobile crisis response teams that includes an officer and mental health and addictions professional acting together for immediate response. Calls for service could come from 911 dispatchers or from the 24/7 crisis line. A three-tiered model would help people get the support they need while alleviating pressure on the police service. Thank you, Mr. Chair, and this concludes my remarks.
Thank you very much for your comments. Just wanted to let you know that the written material that was forwarded to us has been distributed to all board members, and thank you very much for that. Board members, questions?
Good morning. This is Vice Chair Molitor. Can you hear me?
Go right ahead, Vice Chair.
Thank you very much for joining us this morning, Mr. Kim, and thank you for the work that the CMHA does. Very interested in the recommendations you have made, which, as you appreciate, are both municipal decisions and provincial decisions to some extent. I'm interested in particular on the London, Ontario model and want to make sure I understand that the information you've provided around the 10,000 visits to the walk-in health center were related to that particular location, one location in London, Ontario. Is that correct? And if so, can you see how that might play out in a larger area like Toronto? Thank you.
Certainly. Thank you for the question. Yes, in London, Ontario, that figure of 10,000 visits, those were either direct calls to the center or walk-ins to the center or transport from police and paramedics. The Crisis Center has a strong working relationship with emergency services in that community, and police services or paramedic services in that community, when they interact with an individual in distress, they are permitted to take that individual to the Crisis Center rather than the hospital. So those are the statistics that bear out in London, Ontario. We see this almost as a gold standard approach, this three-tiered model for any municipality where police are called on to respond to an inordinate amount of mental health crisis calls. Having that three-tiered approach where there is the option for a pair of mental health crisis workers to attend to an individual who might be in crisis, but might need it not at that immediate time, but perhaps the next day, or that they could de-escalate over the phone to help the individual in the short term and schedule a call for the following day. The way we liken it, the way we discuss it in our office is, imagine if you called 911 and there were, rather than just police, ambulance, and fire, you had the option for a mental health emergency. And then you were connected to a crisis center where you could speak to a trained professional in the mental health and addictions field who could assess an individual and then help make the determination whether this person needs immediate support, whether they need follow-up support the next day from a pair of crisis workers, and help that individual not only assess their immediate needs, but then also connect them with services to help them beyond the crisis, to help them manage their mental health challenges at every other point in their life, not just while they're in crisis.
Thank you for your comments. Any further questions, members?
I have a follow-up question just in terms of that last description of how the process could work. I haven't read your submission yet, and I don't know whether your organization has done a diagram that spells out as clearly as you just explained to us the 911 model. If you do have that, that would be helpful. Otherwise, it is pretty straightforward, but thank you very much.
We can forward that information to the board.
Thank you.
Thank you. Further questions, members? I just have one question for you. You mentioned a tiered response. Many of the speakers over the last few days have said to us we should move all mental health response away from police, but your tiered response actually does include police in some elements. Can you talk about that when you would include the police?
Absolutely. I think, it's always sad and heartbreaking when we hear about, individuals experiencing distress and their interactions with police when they're not positive or result in death. And these are painful reminders of how our health, justice, and social systems are failing, everyone living with a mental health and addictions condition. Having 911 as the de facto crisis line is problematic, definitely, but it is the reality that we're facing today. And this is why we've long held the view that communities in Ontario should have resources to put enough mobile crisis response teams on the road 24 hours a day, 7 days a week as a first response model. Our experience and our partnerships with police services across Ontario, because they are the de facto first response, has shown us that police services also want MCRTs on the road and increased training for all staff. MCRTs are one part of the solution, but I think supporting individuals experiencing a crisis is not a quick fix, and we don't view this as a question about moving money from one pot to another. It requires a really long-term strategy that primarily, in our view, requires more adequate funding across government for things like social assistance, social service programs, adequate funding for mental health and addictions programs so we can help people before they reach a crisis, and adequate funding for police so that there is appropriate de-escalation training and availability of MCRTs.
Thank you very much for your comments. They're very informative. Members, any final questions? Hearing none, thank you very much for taking the time today and for your written submission. Both are very helpful. Thank you.
Thank you. Appreciate your time.
Next speaker, Judy.
Our next speaker is Valerie Michaud, to be followed by Aruna Hanayaki. I hope I pronounced that right. Valerie, can you hear us?
Yes.
We can hear you. Go ahead whenever you're ready.
Okay, perfect. So good morning, everyone. My name is Valerie Michaud. I'm speaking as a concerned citizen living in Ward 10. I work in student recruitment for Toronto universities. On June 29th, Councillors Von Tam and Mutlow motion was struck down, much to my disappointment. Even parsed as amendments, the spirit of the motion was not shared amongst city councillors. I'd like to speak to my own experience with police. I was 16 years old when I had my first encounter with them. I was living in a poor part of town, and one night at 3 a.m. on a school night, 4 officers broke down my front door looking for someone who they had a car chase with. I was risen out of my bed, interrogated in my kitchen, groggy and disoriented. Even at that age, I knew that without a warrant or anyone in imminent harm, they had no place in my home. When I stated this, they simply looked at one another and laughed. I believe that's the first time I felt scared of the police. It was in that moment that I knew that they weren't accountable to the rules that I knew. My knowledge of the law would be reduced to nothing, and ultimately, if anything were to escalate, it would be the word against mine. They interrogated me and my father, searched our apartment for 2 more hours before I could go to bed and get ready for school. This is where I'd like to pause and reflect on my privilege as a white person, that it took 16 years to be fearful of the police that are meant to protect me. Had the circumstances been different, statistics show that this situation could have been very, very different. If I was diagnosed as a paranoid schizophrenic, would they have been able to assess the situation properly and not shot me? If I was Indigenous, would they have placed me in cuffs regardless of the lack of evidence? According to the Human Rights Commission, as we all know, 2013 and up to 2017, a Black person was 20 times more likely than their white counterparts to be involved in a fatal shooting with the police, Toronto police specifically, and 11.3 times more likely than a white person to be part of a police fatal use of force case. So despite making 8.8% of the Toronto population, Black people are systematically over-policed, surveilled, detained, and searched without justification. When even our police chief, Mark Saunders, admits that there is systemic racism in the TPS, that's when you know that radical, effective change is needed. For many years, Black and Indigenous leaders have asked for transparency in the way that police are recruited and the way that they are educated. I think that is the very least that we can do. We need individuals who police with empathy and sensitivity towards the people that they serve. At the very least, we should be dramatically overhauling the system that places angry, aggressive, and trigger-happy police on the force. At best, I would like to see the TPS budget defunded and those funds reallocated to communities and non-emergency and specialized dispatch teams. Teams cognizant of the issues of poverty, mental health, and race. Teams specialized in one area such as mental health, domestic violence, sexual violence, and community liaison. When 80% of police calls can be stemmed to people in mental crisis, we need to have total accountability for those who go on calls and something goes considerably wrong.
Thank you. I have to wrap you up because you're at 3.5 minutes, but thank you very much for your comments. Really appreciate it. Board members, any questions of the speaker?
Vice Chair Mulliner, I have a question for Ms. Michaud.
Yes.
Go right ahead.
Thank you very much for joining us today. My question is more informal. I'm interested in knowing, given your experience since you were 16 and where you are today, whether policing issues have been something you've been paying close attention to over a longer period of time, and how your opinion has changed or not over time.
Yeah, thank you for your question. So I would say since the age of 16, my I guess, view of the police has changed. So there has been time where the police have come and have helped a situation, but the number of times in my experience that I've seen the police interaction go horribly wrong have completely erased the good situations. Coming from Sudbury as well, where there is a very, very high population of Indigenous people, I have seen the police use racist tactics and words and excessive force against those racialized people. So in just that framework, I've seen, and I think that the police are racist, and it's systemic. It's in their hearts. It's in the culture. It's in their minds. And really, in my prerogative, the only thing that we can really do is gut it, restart, reallocate funds in order to make our communities safer and thrive, hopefully without the use of police entirely.
Thank you very much.
Thank you.
Board members, any other questions? Hearing none, thank you very much for taking the time speaking with us today. We really appreciate your thoughts and your comments.
Thank you.
To be next speaker, please.
Our next speaker will be Aruna Hanayaki, to be followed by Elijah Mills. Aruna, can you hear us?
Yes, hi. Thanks for the opportunity to speak. My name's Aruna. I'm a lawyer and a person of color, and I want to focus on two recommendations. Firstly, deterrence and accountability for misconduct. Secondly, reducing the scope of policing in favor of alternative systems. I have lots of other recommendations that I'll say for politicians, including demilitarizing and defunding the police. So firstly, deterrence and accountability. I'm a lawyer. I've done a little bit of work on police misconduct, and I've seen officers engage in misconduct and face no meaningful penalties, and therefore have no accountability or no deterrence against further misconduct. So I would implore you to create a public database of all complaints and findings regarding allegations of misconduct against the police, especially use of force. I would employ you to create a standard that designates, a standard applicable to all officers that designates use of force as an absolute last resort, and a zero tolerance policy for any findings of unjustified force. And here I'm thinking an automatic loss of one's job, one's pension, and with having no chance of being rehired. And I think the impact of these changes would be immediate. You'd see a reduction in the use of unjustified force, improved bonds of trust in the community over time, and especially among Black and Indigenous people of color who are disproportionately affected by unjustified force by the police. And so secondly, the scope of policing, I just believe that police are overtasked, and you've heard it over and over again, that police are called oftentimes to quote unquote help people. And I've read that the Canadian Association of Chiefs of Police estimates that up to 80% of police calls are not related to offences, but instead are related to social disorder, mental health, and other issues. These are social problems that you can't arrest your way out of. Police are not trained or equipped to be youth workers, addiction counsellors, or health professionals. And personally, as a person of colour, I don't want anyone calling the police to quote unquote help me or my family simply for fear that we'll be harmed or killed by the police. So I would implore you to simply stop sending police on these calls. It's not within your mandate as a police force to deal with these problems. And if there's an interim solution needed while you set up alternative systems, I would just suggest that you send unarmed police officers if absolutely necessary. And I would also ask you to work with the communities most affected to come up with alternative response systems, as has been suggested already during this call. And examples to follow here, the prominent one would be Cahoots in Oregon. Last year, apparently, they received 24,000 calls, but needed police backup for only 0.6% of those, a tiny fraction. And the impact of these changes, again, obvious and immediate. You would be tackling social problems with trained professionals, creating safer communities. You would reduce systemic racism, since the people who are in need of these services are disproportionately people of color for socioeconomic reasons. And you would build trust with the community over time and stop wasting police time and resources on problems that you can't solve. So just to summarize, I would recommend and implore you to implement deterrence and accountability for excessive force and all misconduct, including zero tolerance policies, and reduce the scope of policing and replace it with alternative systems that are designed and implemented to tackle the problems at hand, which are social problems that the police are not trained or equipped to deal with. Thanks very much.
Thank you very much. Board members, questions? Hearing none, I just want to thank you very much for taking the time today. Your thoughts were well positioned and very thoughtful. Thank you very much.
Thank you.
Will be next speaker.
Yes, our next speaker is Chris Sarpong, to be followed by Jamila Mills Smith. We'll try to contact Alicia again. Chris, can you hear us?
Hi, yes I can. Hello, good morning to the members of the board. My name is Chris Sarpong. I'm an ordinary Toronto citizen. I happen to be a young Black man, and I'm lending my voice to this critical discussion today. I want to first and foremost thank you all for taking the time to make this symbolic gesture. I know some people might say that this maybe is purely symbolic, but 2020 has definitely reinforced the idea that anybody who is willing to at least assert good faith in a discussion like this, they won't be willing to do so when the chips are down. So I do commend you for taking the time here today. Again, I happen to be lending my voice to this discussion regarding defunding the police, not because I believe the police are good or bad, not because I believe defunding the police, whether that's 10%, 50%, abolition, or anything in between, and allocating those resources would be some sort of miracle fix for the city. It won't be. But I implore you, a board comprised solely of city councillors who are opposed to defunding to reconsider your position, because we need radical, forward-thinking reform if we actually care to even start to address the socioeconomic issues in our city. The specter of the Toronto Police Association aside, on a basic level, this shouldn't really be a question. We desperately need to aggressively fund social services, programs, and outreach for our vulnerable, marginalized, and racialized communities. Toronto Police Services is our biggest line item. It's a bloated billion-dollar expense, but there's not a fiscal conservative to be found when it comes to the police budget. TPS and police forces in general, as a previous caller just mentioned, have consistently shown themselves to be beyond reproach in this regard, and it's something that we've seen manifest itself far, far too often recently. It's shameful that I can look at a map of Toronto, point at 31 Division, or the northwest corner of our city, and simultaneously be pointing to the area most affected by COVID-19, the area most affected by gun violence, the area with some of the most crowded bus routes in the city, and it all coincided with the area with the highest concentration of Black people. Many people see the violence and poverty in this area as proof that these communities are simply irredeemable, and they immediately want to throw more police at the problem. And I understand the impulse, which unfortunately does come from people of all stripes, but it's just that, it's an impulse. More police does not equal more safety. Just a precursory look at the data can tell you that. Toronto, we're a city of almost 3 million people. We have 5,400 sworn police officers. That's about 185 officers per 100,000 people. We see about 75 homicides per year over the last 5 years. Chicago, 12,000 sworn officers, 2.71 million people in the city, 435 officers per 100,000 people, over double our rate, and they haven't seen under 400 homicides since the 60s. New York, 8.5 million people, 36,000 police officers, 425 police officers per 100,000 people, and they see 320 homicides over the last 5 years per year. And this is the same New York City that nominally cut $1 billion from their police budget. It's more like 500 or 600 million, which ironically works out to about 10% of their budget, that arbitrary number that we've been talking about here in our city. For far too long, we've just sort of allowed this impulse and this notion that police are the only thing standing between us and the criminal other who wants to terrorize and harm us if they're only given the opportunity to do so, to blind us from actually addressing the disease of systemic inequality that we see in our city, and rather focus on punishing the symptoms. And I'm not saying that defunding the police to some extent is the solution, but make no mistake, so long as the mere thought of doing so remains some sort of radical idea, we will literally never solve this problem, and that is without question. So I do, again, implore the board, implored our councillors, Councillor Ford, Councillor Naziata, to really reconsider what it means to start this discussion in an earnest way going forward, because it's about more than just the monetary aspect of it. It's about the sort of the message it sends to the city. Thank you.
I've got to wrap you up because you're at 3 minutes and 40 seconds. Thank you very much for your comments. I appreciate them. Board members, any questions of the speaker? Councillor Ford, do you have a question?
Mr. Chair, I don't have a question. I just a comment, more so than I just thought Chris's comments were very helpful. I know Councillor Nunziata is here and myself, and we're listening, and I thought his comments were very good. So I just want to add that.
Thank you for that, Councillor Ford. Any other comments, board members? Vice Chair, did I hear you?
Yes, thank you. Thank you very much. Thank you very much, Mr. Sarpong, for joining us today. And I agree with Councillor Ford with the thoughtfulness of your comments. Very helpful. I'm wondering, you did not address, and it's a question I asked the prior deputant, the issue of body-worn cameras. So I appreciate that that's an investment, and I'm not going to get into it in terms of whether it's a good idea to spend more money on the police. But if one is to invest in body-worn cameras, I'd be interested in your perspective. Thank you.
Right. So I suppose I differ a little bit from what the sort of common line on, I guess, with some of the more progressive folks and these sort of activist ranks on this. I do think body-worn cameras are a good idea. I'm actually, again, it's kind of sad that all of the things that have sort of happened over the last several months have necessitated, have finally got us to come around on this. I mean, body-worn cameras were something that was in the 2017 police, the way forward, transforming Toronto police sort of recommendations, and obviously never was followed through on in the actual capacity. So the idea that this sort of crisis needs to occur for this to come around is a little bit disappointing. But to me, I think they're important. I think they're a necessity in the sense that as long as they don't increase the police budget, as long as we make sure that we're taking from what we currently provide to the Toronto police to implement this, to me, they seem like a sensible measure. But as far as increasing the budget to implement them, I would agree with many of the people that speak in this respect of it being a little bit of a red herring and something that's simply distracting us from more important reform. I wouldn't want it to increase the budget, but I do support it if it can remain the same or lessen while implementing them.
Thank you.
Board members, you have a follow-up question, Vice Chair?
No, I was just thanking the deputant. Thank you.
Any other questions? I just want to give a point of clarification around the budget for body-worn cameras. That was actually placed in the budget for this year, last year, well before recent events. So I don't want anybody to think that we're pushing it forward now because of very recent events. That was something that was put in the budget last year to be implemented in the second half of this year. So I just want to bring clarification to that. Thank you very much for taking the time to call in today, and your comments are very helpful. Thank you.
Thank you.
Who'll be next speaker?
Our next speaker is Jamila Mills Smith, to be followed by Sebastian Mendoza Price. Jamila, can you hear us?
Hi, I can hear you. Can you hear me?
We can hear you. Yes, we can.
Okay,
Go
great.
ahead whenever you're ready.
Hi, so my name is Jamila. I'm a Black woman. I've lived in North York and St. Albert, Alberta. I've seen the benefits of what public funding for community programs and organizations can do, and alternatively, what happens when funding is reallocated to increase police budgets. The former trumps the latter in terms of benefits, but police services are still funded with increasing vigor. I'm speaking in the names of Regis Corshinsi-Pasquette, DeAndre Campbell, and Chantel Moore, whose lives ended too soon because of police violence and improper training. The TPS has a 2020 operating budget of $1.22 billion, which is the single biggest line on the city's operating budget. This should account for proper training, but police-involved fatalities in Canada are rising, and police force use in marginalized communities and on citizens with mental health issues are highly disproportionate to other communities. It was found in a 2018 OHRC report that Black people are overrepresented in police use of force cases, representing 9 out of 15 police shootings resulting in serious injury or death, and 8 out of 13 use of force cases resulting in civilian death. From 2000 to 2017, there are 461 fatal police encounters, and while Black people only make up 8.3% of the Toronto population, they made up nearly 37% of these victims. Similarly, Indigenous people make up 5% of the Canadian population, but comprise 37% of the last 100 deaths by police. And it was found in another OHRC study that the TPS has been found guilty of unnecessary charges and arrests, inappropriate or unjustified searches during encounters, and lack of legal basis for police stopping or detaining Black civilians. Police training focuses on use of force and enforcement, but this occurs disproportionately in Indigenous and Black communities and does not fully encompass the training needed to de-escalate situations regarding mental health and substance abuse crises and issues involving people of color. Furthermore, the police budget is larger than public funding for libraries, housing, and shelters combined. The TPS is meant to serve and protect, but the data shows that the egregiously large operating budget has done far more damage to BIPOC and at-risk individuals than good. And the benefits of these aforementioned institutions shouldn't be overlooked. It's shown that libraries combat lower literacy rates nationwide, and higher library traffic is linked to more economic activity for local businesses. Additionally, permanent supportive housing helps to provide safe and stable environments for people with mental health and substance abuse problems and those experiencing homelessness. And NYU researchers found that in a city of 100,000, for every community-led program and organization, there was a drop in the homicide rate, the violent crime rate, and the property crime rate. I ask you to just imagine what that would look like in a city of 6.2 million people. So I ask of you, call to decrease the TPA's budget by a minimum of 50%, because the current budget doesn't seem to be working in keeping BIPOC and those suffering from mental health issues, substance abuse issues, and homelessness safe and protected. I instead ask for a reallocation of funds to community-led programs and organizations like libraries, shelters and affordable housing, community-run health centers, and mental health and restorative services. I ask for the remaining TPS budget to be used to the best of its ability to create community-led, trauma-informed emergency services for mental health and psychiatric distress, to call on medical professionals for mental health crises and wellness checks, and to call in well-versed community-led organizations and professionals to assist and oversee de-escalation and cultural sensitivity training every quarter for the next 10 years. That's it.
Thank you for your time. You're well over your time. Thank you very much for your comments. Really appreciate them. Board members, any questions of the speaker?
Vice Chair Mulliner here.
Go right ahead.
Thank you. Thank you very much for taking the time to review the data behind your deputation this morning, Ms. Mills-Smith, and thank you in particular for your last focus on the mental health area. One of the areas you did not cover, which I've asked other deputants about, is body-worn cameras. I'd be interested in knowing whether you have given that any thought, whether or not they are a good idea, and anything else you may want to offer on that. Thank you.
So body cameras, if you can confirm this for me, Speaker, would cost more money, I'm assuming, yes?
So the chair was just saying prior to you joining as the speaker that the amount of money set aside in the budget for any body-worn cameras was identified last year, and I'll let the chair speak to any increased budget impact. We haven't had that conversation yet as a board, so assume that the funding for the body-worn cameras is in the existing budget for the purposes of responding.
Okay, all right. So assuming that it's in the same budget, that still doesn't change the fact that it would help to a certain degree, but there are many studies by many people that show that body cameras don't have any discernible effect on the use of force. And many of the issues with TPS is resolving cases with mental health and cultural insensitivity. And with all due respect, even if there's a body camera on, I don't really think that's going to affect what an officer thinks that their life might be in danger because someone else's life is in danger. A body camera is not going to change the fact that they're not properly trained to de-escalate certain situations. You need to call in someone who knows how to handle the situation with mental health crises, and a police officer can be there as an escort. And if any reason, use force for any particular reason, but there should still be another body there that is properly trained to be there to help with the situation.
Thank you. That's very thoughtful. Thank you.
Any further questions, board members? I just want to pick up on your last comment there. You indicated that perhaps police would attend these calls as an escort. Could you just follow up on that comment a little bit for me?
Yes. So I heard in the very first call that from someone who was a mental health professional that they often feel like they need to call in the police. And for many people in the city, the police is a form of reassurance. But in terms of mental health crises, in the event that the person gets violence and the medical professional doesn't know how to handle that, then the police escort would be helpful. But the police escort may not have gone to school for mental health issues. They may not know how to de-escalate the situation. So there should be two bodies there to handle their business. The person who's getting violent, the police officer would handle that. The person who's in need of a mental health professional who thinks that they might jump off a balcony, they need a mental health professional. A police officer may not know how to talk them down. And it's been shown that they're not handling it well. So you need people who know how to handle certain situations. So if someone's getting violent against a medical health professional, then the police officer can help them. But it shouldn't be a situation where they immediately get shot, they immediately die, or they're immediately injured beyond repair. It should be something to protect the medical health professional and the civilian who's at need. So that's what I mean.
Thank you. Board members, any other questions? Hearing none, I want to thank you for calling in today, and thank you very much for your balanced perspective. We appreciate it.
Thank you.
Could be next speaker, please.
Our next speaker is Sebastian Mendoza Price, to be followed by Louis March. Sebastian, can you hear me?
Hi there. I can hear you, and I hope that you can hear me. Before I introduce myself, I just want to point out that deaf people, particularly deaf and hard of hearing people of color, face communication barriers that put them at additional risk when interacting with police officers. Thus, it is a bit of a shame this opportunity was not taken to include their voices in the conversation here by providing an ASL interpreter, as the automatically generated closed captions on YouTube are currently not providing the correct captioning of what is being said. So just something to consider. With that being said, my name is Sebastian Mendoza Price, and I am an anti-racism organizer based in Ward 13. I am calling in to support community demands to defund the police with an immediate 50% reduction redirected to critical social services. The mayor has mentioned more than once now that the time is running out for the City of Toronto to maintain its current level of social services, and major cuts could be on the horizon, though it seems police will not face cuts, but rather a possible increase in funding for body cams. We have clear data that establishes the necessity of a functioning subway system or a safe, expansive, and accessible library network, because each of those organizations have to provide this data. Yet every single year, the police have gotten a funding increase that complements an increase in crime. So it seems that they aren't doing their job, yet no other agency in Toronto would be given increased funding after consistently failing to deliver results for Torontonians. In fairness to the police, they cannot quell crime that is a reaction to extreme poverty and structural racism, yet they definitely act like they can shoot their way out of our city's poverty crisis. Councillor Nunziata, who is on here, mentioned it in the council meeting on June 29th, where the budget cuts to TPS was presented, that she has heard extensively from mothers who are tired of shootings. I want to be clear about what causes these shootings. The amount of unfair evictions, displacements, environmental challenges like floods, and police brutality that perpetuates structural racism puts York Southwestern residents on the uneven footing that requires youth to commit quote-unquote crime in order to literally feed their family. And these same Black mothers in York Southwestern and across Toronto know this. I work in communities similar to YSW. I wish, as do they, the councillors fought to actually end those barriers. The police have not shown that they are a useful number in the equation to eliminate poverty and thus violence in the city. Up until the recent council meeting, they had never even offered to give a line-by-line spreadsheet of their expenditures. I suggest the TPS start being transparent about where their money goes and be open to significant budget reductions, as all institutions within the public service seem to have to inevitably burden. As of today, the police have not justified why they should be immune from budget cuts and are thus harming the city's plan to rebuild our city and its social safety net. This is why there's a lack of trust between the city and the TPS. They are not accountable. I highly advise the council and the Toronto Police Services Board reconsider its decision to increase police funding and instead protect our city's social services by reducing police funding. It will lead to less crime, and the data existing already out there shows as much. Thank you.
Thank you, sir, for your comments. Board members, any questions? Hearing none, I just have one comment. You mentioned about transparency in the budget. I just want to let you know in the coming weeks, very soon, we'll be putting up a much more transparent budget than we have in the past and getting as close to a line-by-line breakdown as we can and continue to work on transparency in the budget process. So we're working on that right now. Thank you very much for your comments. Thank you for your comments and have a good day.
Vice Chair Hart, I have a question. Thank you. I just wanted to respond to the Deputant Mr. Mendoza Price's observation around the lack of ASL sign language, and I appreciate that we're all learning how to do this better. And I did want to acknowledge that and to also let you know that at the end of this, and I think the chair can expand further if he thinks I haven't captured it, we will be producing a range of information, including some graphic representations of the conversations that have been had and the deputation. So hopefully from a visual perspective, you will be able to, or people who need to will be able to review information, which is not the same as being here, but there will be a record of these conversations. Thank you.
Yeah, I hope that, yep.
Sir, do you have a comment?
Yeah, I just hope that if that is the instance, that the Toronto Police Services Board would reach out to deaf organizations and maybe hold, conversations with those organizations or with deaf people of color to provide additional deputations, and maybe they could work closely with organizations who do the work with deaf people on the ground. Because again, like you said, being able to review is not the same as participating in something. So I think that's something that the Toronto Police Services Board should be actively working on, as I am not the first person to have mentioned the lack of ASL interpretation. I have seen a lot of deaf organizations bring this up on social media. Thank you.
Thank you. We appreciate your advice and have a good day.
Thanks.
Will be next speaker.
Our next speaker is Louis March, who is the last on our list for now. Louis, can you hear us?
Yes, I can hear you. Can you hear me?
Yes, we can. Go ahead when you're ready.
Awesome. My name is Louis March. I'm the founder of the Zero Gun Violence Movement. It's a collaboration of over 40 different organizations, agencies, programs across the city of Toronto working towards our very ambitious objective of zero gun violence in the city. I know it's very difficult for people to understand that concept, but we already have zero gun violence in the city, but we only have it in certain communities for certain people. So our challenge is, why is there a difference between living in Rosedale and Rexdale when we know the differences, and what are we doing to close that gap? So that's what Zero Gun Violence Movement is about. I've been working with Black youth in our community for an extended period of time. In fact, in 1979, we organized a provincial Black Youth Conference at the Scadden Court Community Center to discuss issues that were impacting the youth in our community. The two top issues were police brutality and racism. And 41 years later, we're discussing the same two things. My reason for speaking today is to address one of the issues that seems to have fallen by the wayside. It's the public trust, the public confidence, and the public faith in the policing system has eroded over the last few years. And when I say eroded, I mean what we're seeing on the streets, because we work with victims of gun violence, but we also work with people that have been responsible for it. We also work with a lot of youth on the street. And what they're telling us from their encounters with the police is not what is being told in its fullness, in its accuracy. For example, police brutality. One young person I just spoke to, he said he had been stopped over 10 times in the last year by the police. No charges. He ended up in hospital on 2 occasions, but he will not come public for fear of retaliation. We're concerned about that. When we have lost trust and faith in the policing function and operation, we have a major problem, because the chief has spoken significantly about improving community relations. In one particular community, we saw the community officers working with the youth and then establishing a relationship and making progress, significant progress, in terms of opening the channels of communication and building trust. But then one incident later, a young 13-year-old broke his bail conditions. 8 police cruisers showed up to take him down, right? And it was a very violent interaction in the sense that a lot of people saw what was taking place. All the good work that had been done in terms of building up that relationship and that trust in the community was destroyed. And I think the police need to take a look at what's going on inside. Why is it that certain police officers think that they can put on the uniform and do this? Because what it does, it destroys all the good work that has been done before. I think the focus must be a lot on how do we regain that trust, because one incident alone, and because it's captured on video these days, and when we hear what the police are saying and what we're seeing on the video, there's differences. So how do we restore that trust and confidence so that the community can work with the police? We're not looking for quantity of policing, we're looking for quality of policing. And
Thank you, sir. You're at 3 minutes and 40 seconds. So I have to wrap you up. Thank you very much for your comments. I'm sure you'll get questions.
No problem.
Board members, any questions?
Yes, Mr. Chair, it's Councillor Nunziata.
Yes, Councillor Nunziata, go right ahead.
Yes, thank you very much for your deputation. And I do agree with you. And you know, there are parts of the community where we have police working with the youth, engaging in the youth in different programming, sports, and they've been able to have that trust and work together. Now, you mentioned how do we restore that confidence? So in your opinion, what is the solution on restoring that confidence and working with the community? Would you agree that we need help and support from the community as well to work in partnership with us?
Thank you very much for that question, Councillor. The first word in community safety is community. If community is not an integral part of this equation, we cannot have community safety. So there has to be more effort invested in working within the community. The majority of police officers do not work in the community that they work in. Most of them come from outside the city into the city. There's a disconnect initially at that. So you can balance it off by more training, cultural sensitivity training, but also including the community as part of that training process. The transparency, what we're hearing on the street, Councillor, is the fact that a lot of stories are not being told. Shootings are taking place that are not being, the phone call to the police doesn't even take place anymore. When police come into the community, people shut down and they don't want to work with the police because of the perception of working with the police. So we've had that problem since 1979 when we had that conference, but we have not done the transformative change, the radical changes that inserts community as part of the policing process. And whether it's part of the training, part of the operation, that will go a long way in terms of improving transparency and seeing police and community working together as partners, not as adversaries that we see in many of the communities right now.
Thank you.
Board members, any other questions? I have a question. Do you do some work? I think you said you do some work with individuals in the community who may be involved in gun violence. If I heard you correct, can you explain a little bit about what you do and what successes you've had in that regard?
What we do is we work with across the city of Toronto. We work with the victims of gun violence. That means mothers who have lost children to gun violence. But we also work with those people responsible for the violence. People that have done the crime, done the time, and now want to make a difference. So we do not go into a community by ourselves. We're normally invited into communities. And what we find is that those people that are trying to make a difference, they have a connection with the community that zero gun violence alone by itself does not have. So we work with this population because they actually do care. They know the landscape. They know what got them into the mess that they got themselves into, and they know the way out. They know the pathway out. But they also are able to connect with those people that are on the verge. What we're seeing now in terms of the gun violence, we're concerned more about ensuring that we do not have a next generation that grows up thinking that the gun culture, right, is okay. That's why we need that population in there early right now, engaging those people because they can do work that the police cannot do. They can do work that community organizations can do. So even throwing money at community organizations, we have to question because a lot of those community organizations are not able to connect with the population that are involved deeply in the criminal activity. The people that have that gateway to this population are normally the people that have been involved, that have done their crime, done the time, and want to make a difference. So we put a lot of value in this relationship, and also we put a lot of value in their commitment to do this to make a difference.
Thank you very much. We're listening very closely to what you're saying. Appreciate that.
Chair Hart, it's Vice Chair Molinar. I have a follow-up question to your question.
Go right ahead.
Thank you very much, Mr. Martin. Thank you for your response just now. It made me wonder whether you'd be in a position to tell us, because I appreciate that the work that you are doing is outside of the community, the traditional community organization structure, and I understand why. Can you tell us what it would take for that level of very local work where you're working with people who are trusted and are able to reach the youth who might otherwise be on the verge, I think was the word you used. What would it take for you to be able to do, or your group, or this kind of work to be replicated in terms of resources? What would the model look like that could be invested in at a local level?
That's an excellent question, Councillor. I wish I could tell you a simple answer to it, but we have servicing models. For example, the traditional service is between 9 o'clock in the morning to 5 p.m. Our work on the street sometimes is between 9 p.m. and 5 a.m. The servicing model has to change. We have to do a radical review, a systemic analysis of what we have on the streets right now in terms of resources, support, and how do they match up with the demands and the needs. And we've not been able to do that. A lot of these organizations are not delivering the impacts that they need to or that they claim they are doing. So just throwing more money at organizations, we have to take a look at that. We have to be looking at what is actually working. What is the dynamics of that organization? What is the makeup of that organization? What is that service model? Who are the people operating? Who are the people running these programs, right? And it means we have to get uncomfortable because we're going to have to change the servicing model that we currently have in place because it's not delivering the results in the majority of cases. Again, are we willing to get uncomfortable by taking a look at our physical space, the programs, who's running the programs, what are the program outcomes? And we have to be very honest about this because we're just throwing money out there. And I'm sure, just like how we spend more money on policing and we don't get the results, we're spending more money on programming and services, and I question sometimes the results, even though I support that we need programs and services, but they must be targeted programs and services run by people that can drive the impacts that we need. Toronto is a very resourceful, rich, acclaimed international city. We have the resources and means to do this, but are we willing to change lanes at this particular time? And I question whether or not we have the political leadership and will to do it, because our response has always been throw more money at the police, and we know what that has proven.
Thank you very much.
Thanks for hearing me out.
Members, any other questions? Thank you very much for calling in. You've made some excellent points. We really appreciate it.
Have a blessed day.
You too. Doobie, I believe we had one more caller just call in. Is that individual on the list?
Can I make a comment now, please? Hello?
Who's this?
Yes. Caller, can you please?
Okay. My comment is in support of the just previous person. We have resources. We don't monitor them, how they are managed and spent. That's one thing. But the biggest resource is the fact that the police is working overtime for private companies and standing guard for construction companies. Police, if anybody is making super extra money, sometimes twice as much as they make as a policeman on another job, the policing job is the rest on the job type of thing. The best solution that we could make is absolutely demand that police do just the policing and they work normal hours. They do not rest on the job while making extra money outside of the job. Police should not be employed anywhere else but only by the police. Here is the question of the resources. Thank you. I'm finished.
Thank you for your comments. Board members, any questions? And thank you very much for taking the time to call in. Do we have any more speakers?
No, that was our last one.
Okay, thank you everyone. I just want to remind anyone who was listening that we followed up twice with everyone who registered this morning, and everyone has been contacted, so every individual has their own decision why they didn't call in this morning, but we've given everybody full opportunity to do so. So we're going to wrap up this morning's session. We'll be back for an afternoon session at 1:30. Board members, thank you. Any final comments from any board member?
Chair Hart, Vice Chair Mulliner, as you know, I will not be able to attend this afternoon or tomorrow's sessions, but I very much appreciate what I've learned thus far and will follow up by watching the that's on YouTube. Thank you.
That's great. Thank you, Vice Chair. We'll see everybody at 1:30. Very much and enjoy the rest of your day.
Mr. Hart, you're ready to go.
Good afternoon, everyone. My name is Jim Hart, and I'm the chair of the Toronto Police Services Board. Welcome to the board's town hall meeting, the third in a series of 4. I'd like to begin with a land acknowledgement. Although this meeting is taking place virtually, we acknowledge that the land we're on as we meet the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and Wendat peoples, and is now home to many diverse First Nation, Inuit, and Métis people. The board also acknowledges that Toronto is covered by Treaty 13, signed by the Mississaugas of the Credit, and the Williams Treaty, signed by multiple Mississaugas and Chippewa bands. Today's meeting marks the third of 4 town halls that the board will be holding. We've arrived here after months of a pandemic that has seen a complete upending of what we knew to be the normal way of life. COVID-19 was causing and continues to cause many people to feel stress, anxiety, and considerable uncertainty. These feelings create a foundation that were overlaid by the tragic deaths of Ahmaud Arbery, Breonna Taylor, George Floyd, and Regis Korchinski-Paquette, and others. This led to a global conversation on police reform, officer accountability, and the importance of applying new lenses on issues of community safety. Toronto's not any different. And even here, we've seen thousands join in demonstrations, which have become commonplace in the last few weeks. We've watched these protests, rallies, and artful expressions, and want to provide an avenue for members of the public to speak directly to us, your Toronto Police Services Board. When we opened the opportunity to engage community members in an informal setting, hundreds of people registered, prompting us to extend our town hall to 4 days to ensure we could hear from as many of you as possible. For those who are unable to register, we're still accepting written, audio, and video submissions on our website until the end of this week. All submissions will be compiled and shared publicly in the coming weeks. Our staff are also working diligently to ensure that we're capturing all of the advice, recommendations, and sentiments from this town hall meeting. We will be exploring a variety of ways to share the final summary of these meetings, including using digital, graphic, and online platforms. All of the feedback that we receive will be part of a consideration of a referred report from our June the 19th meeting to our August the 18th meeting of the Police Services Board. Before we get started, I'd like to go through some housekeeping items. All meetings will be chaired by me, alongside other board members. Over the course of 4 days, you'll see different members joining us. This afternoon, we have Councillor Francis Nunziata and Councillor Michael Ford. All speakers will have 3 minutes to speak. When your name is called, please be ready to begin. We recognize that this is an unprecedented and unconventional way to host a town hall meeting, but one necessitated by the current context. Should we have any technical glitches, we ask that you be patient with us. And as a final comment, I want to let all of you know that we had about 45 people signed up for this afternoon's session. And I believe that we have less than half of those with us this afternoon. Some people have chosen not to attend this afternoon. We reached out twice to all of those individuals, but we have the individuals who have signed up who are here now. And we will be listening to every single one of you very intently. And I thank you, and all board members thank you for joining us this afternoon. And with that, Doobie, please put on our first speaker.
Mr. Hart, our first speaker is Brendan, to be followed by Susan Gapka. Brendan, can you hear us?
Yeah, hello.
Hi, go ahead whenever you're ready.
Hey, yeah, so my name is Brendan Gill. For preface, I was born and raised in Toronto and consider it one of the best cities in the world. Onto the topic of accountability. So let's jump back 10 years to the G20 summit. Where is the accountability for the human rights violations and flagrant violation of our charter rights committed by the Toronto Police during that time? I have multiple friends who were illegally kettled at Spadina and Queen, kidnapped and imprisoned in the Toronto Film Studios by the Toronto Police. I had a friend who was falsely arrested downtown and driven far north in the city and kicked out of a police van by the Toronto Police. I personally, was searched illegally 4 times that day by the Toronto Police. My charter rights and the charter rights of thousands of Torontonians were violated that day, and there was little to no accountability. Do I trust the police as a result? Absolutely not. Do I distrust the entire police force due to their veil of secrecy and the thin blue line that they have pulled? Yes. Is this a perfect example of what marginalized communities and POC experience on a daily basis by Toronto's corrupt police force? Yes. Do I feel sickened and disgusted that I pay taxes which fund this corrupt police force and their overinflated budget? Yes. What are you doing to change the public's perception of the Toronto police force? There should not be any expectation that the public should be anything more than angry at and scared of the Toronto police because of their track record with corruption and blatant lack of accountability. The onus is on you to correct this. How will you work to remedy this? And how can you change people's viewpoints? And how can you change my viewpoint?
Board members, any questions?
We seem to have lost Brendan.
I believe the speaker has hung up, perhaps. Debbie, can you put on the next speaker?
Yes. Next speaker is Susan Gapka, to be followed by Vanessa. Susan, can you hear us?
I can hear you. Can you hear me?
Yes, we can. Please
Excellent.
go ahead when you're ready.
My name is Susan Gapka, she, her pronouns, and I thank you for listening to me today. I grew up living on a military base at Trenton, Ontario, the home of Air Transport Command, after living on an air base at Metz, France. My grandfather was a World War I veteran and a veteran of the Boer War. My father was a prisoner of war with the Royal Canadian Air Force during World War II and the Korean War, where he was tortured and left mentally and physically injured and hospitalized throughout my childhood, causing enormous hardship, distress, and conflict within the family unit. As a teenager, I rebelled and fled to Toronto and eventually became homeless on the streets. During that time, I struggled with issues of mental health and addiction. Ongoing negative interactions with authorities, including the police, offer me an extremely complicated relationship with the authorities, and over the years has caused me much pain and grief. Today, I speak as an individual and a member of the trans community, part of the LGBTQ community, living near the village across from Ryerson University. I'm proud to tell you that I am in long-term recovery from my mental health and addictions for over 20 years. Our community has a complicated relationship with authority and the police. Some members are concerned about their public safety in growing racial and economic inequality in the downtown East neighborhood. Others are deeply embedded in the defund the police protestations and call these town hall meetings a sham. Myself, I prefer a balance in public policy implementation and strong governance mechanisms. In the short time I have left, I'll make two key recommendations. The first one is to delay the implementation of body-worn cameras until at least January 2022. And the key rationale is budget considerations coming out of a pandemic response. Toronto cannot afford the $5 million annual expense, and over a 10-year period, $50 million. I have more points, but less time, so I'm going to go to the second key recommendation, that the City of Toronto develop a mental health response unit, perhaps within Toronto Public Health. City Council approved the implementation of a mobile crisis assistance intervention service and a review of the Cahoots model from Eugene, Oregon. We've also done this with the model at the Mayor's Task Force in Toronto Community Housing, where we moved senior housing to within the city, and we provided public agencies, I believe I'm at time, so in conclusion, I am seized by this matter. On the surface, positions appear oppositional and divisive, yet I'm hopeful. My cup is half full. Thanks to a massive global movement led by Black Lives Matter, significant change is coming. Views vary on timelines, techniques, strategies, and tactics, yet we are all now mostly pulling in the same direction. Change in policing is coming sooner rather than later. And for that, I remain hopeful.
I have to close you off there. You got 3 minutes and
and
40
at
seconds.
Your service. That was the end.
I'm sure you'll have questions, Susan.
I hope so.
Councillor Ford, I believe, has a question of you, Susan.
Thank you, Mr. Chair, and good afternoon, Susan. Good to hear from you. Just a quick question. You mentioned that you would request us to delay the implementation of body-worn cameras until 2022. Do you believe they are a useful tool, though? Because I know you cited budget considerations for doing that. But do you think beyond 2022 or whatnot, do you believe they're a useful tool for Toronto Police and accountability?
It was. So my two other points was that if managed appropriately, thank you for the question, and adhering to all of these recommendations come forward, mental health professionals should be the first responders and not the police, subsequently rendering the body cameras unnecessary for most of these concerns. And also that surveillance technology is sold by international corporations. They're not the appropriate response to policing, and in my view, the wrong default position. I think this is why a lot of people are angry. The first thought is, we'll buy more technology. We need to respond better to de-escalating using mental health professionals, and the city has some amazing people.
Okay, thank you very much.
You're welcome. I'll send the written deputation.
Excellent.
Board members, any other questions? Susan, I just have one question for you. Given your vast experience with community engagement, can you give us one recommendation to get the police closer to community?
Oh, you had to ask me that one, eh? Well, I think the police service has been moving in a generally positive way. You have the you're doing some racial data collection. That's complicated. You have a couple advisory committees, and you have some very good people on those committees. On mental health and addictions advisory panel, and you also have, I think, the anti-Black racism or anti-racism advisory panel. So I think in some regards, that is, having people with expertise in public policy, mental health, and anti-racism be the first responders. So using their expertise. Secondly, when we talk about we need more police in our communities, there are different views on what community policing is. We're not talking about a task force coming to solve our too many people sleeping in tents in our parks. We need to build relationships with people struggling, who are homeless, who are using drugs, who have mental health crises, and we need to build relationships with those people. And the city needs to do more around funding the social determinants of health so that we can lift everybody up.
Thanks, Susan. We really appreciate your comments, and thanks for all the work you do to make our city better. We really appreciate it.
I appreciate it. 3 minutes was hard, but I appreciate your questions and your time. I want to wish you the best.
Have a good afternoon.
Bye-bye.
Next speaker, please, Doobie.
Our next speaker is Vanessa, to be followed by Dancy Mason. Vanessa, can you hear us?
I can hear you. Can you hear me?
Yes, we can. Go ahead when you're ready.
Good afternoon. I would like to share my appreciation to all of the community members that have taken time away from their jobs and lives to share their perspectives here. The community is telling you that they do not feel protected and that the service you are providing is failing them in every way. And I hope you are genuinely reflecting on that. I want accountability from the Toronto Police Service. It was immensely disappointing to see City Council increase the police budget in order to acquire body cams, which reporting shows are unreliable as officers have the power to turn them on and off at their leisure, and police forces have been known to not release evidence from body cams to the public. We do not need body cams, we need better, more sufficient training. I am adding my voice to defund the police budget and use that money to create a separate community-based mental health organization. In much of the reading I have done, the response from police seems to be, quote, "We're asked to do too much." But here's the thing. No one has asked you to do any of it, but you have taken it on yourself and are failing at it. A pretty good general rule is that if you don't have the range to handle a problem, you should find someone that can. Officers don't have the range to deal with most of the situations they deal with daily. This is a problem. I hope during this time that you are listening, you are also reflecting on your own processes and training, because people are senselessly dying on your watch. Your systems are not working. This is a problem. I would now like to review the abysmal standards for training as per the Toronto Police Service website. Quote, upon being hired by the Toronto Police Service, every new recruit will begin their career as a cadet in training and will proceed with formal training as follows. 3 weeks of orientation, 12 weeks at the Ontario Police College, 9 weeks of further training at the Toronto Police College. Courses covered during this 24-week program will include defensive tactics, driving, firearms, neighborhood policing, and investigative training. End quote. Furthermore, John Tory said on the July 9th town hall, and I quote, training happens in a burst when they first get recruited, and then they have annual training, which is really a modest number of days that happens over the course of a year. End quote. How is it that you as a police board agree that this is sufficient? Stats Canada shows that police officers are paid on average more than school teachers, nurses, and social workers, all of whom must have degrees. On average, a lawyer has a minimum of 8 years of schooling before they can practice law. So how is it you think it's reasonable to instill authority and ability to uphold the law into someone that has a mere 24 weeks of training without prerequisite of post-secondary? Giving power without context is proving to you in real time how dangerous this approach is. I implore you to look at other countries that are decentralized and have sufficient training. Germany is a great example for you to research. There are countries around the world that require much lengthier schooling before becoming a police officer, and many do not use guns or lethal force, and because of that, they have drastically lower incidences of police violence. They are also even respected. In a city that is suffering from a housing crisis and insufficient public transit, to see what the city is spending on policing is abhorrent, and you should make every effort to fix this. I yield whatever remaining time I have.
Thank you very much. Really appreciate your comments. Board members, any questions? Seeing none, again, thank you for spending time with us this afternoon. Your comments were very helpful. Have a good afternoon.
Thank you.
To be next speaker.
Our next speaker is Dancy Mason, to be followed by Mary. Dancy, can you hear us?
Yes, I can. Thank you. Hi, my name's Dancy Mason. I'm speaking as a concerned private citizen in support of defunding the police. People here and in the previous days have already made a bunch of excellent observations about why defunding the police is a necessary first step. I want to use my time here to talk about a specific concern of mine, and this was also actually one of Vanessa's, which is this conversation around police body cams as a middle ground between doing nothing and defunding the police. So my brief comments are focused on why I think body cams are not the answer and defunding is. So body cams are still new, but just to use one example, a study published in the National Academy of Sciences suggests that they actually make the officer seem less culpable than dash cams because we don't see them acting, so they aren't an actor in that altercation. If an egregious incident did happen then, body cams won't necessarily present objective truth. And that's completely apart from compliance issues around wearing and turning on the cameras, or the fact that by the time body cam footage matters, someone may have already been harmed. And I'd be happy to send more information about that study along. But my larger point is this. In the end, whatever partial solutions they offer, body cams can only ever record an already broken, racist, colonialist, and ableist system. They can't fundamentally change that system, and they very well may support it. So they're a narrow solution, and I think a short-sighted one, but better things are possible, and better things are what me and people like me are pushing for. Just like someone with a hammer, everything is a nail, a monolithic and racist system has gotten us a police response where every Black person, Indigenous person, or person of color is a potential criminal. It doesn't have to be this way. Police officers are not mental health workers, and they don't have a tool set to deal with all of society in nuanced ways. We shouldn't ask them to. we're in an unprecedented time, and it's one where we can really take stock of our society and rewrite some of the wrongs at the very least. We should redistribute some of the police budget, and that proposed 10% cut is so minimal for the duties we're not going to ask officers to do, and give it to experts on community services, mental health, and youth work. I think I see a lot of conversation about this being some bitter winnowing down of police power, which I'm happy that it is, but it's not just leaving it at that. It's about reconstructing a better society, and I think body cams are just the most short-sighted answer that we can possibly think of when it comes to this. Thank you. I'll yield my time.
Thank you very much for your comments. Board members, any questions? I just have one question of you. You mentioned body cams, and a number of speakers have mentioned why they're not in favor. Certainly from the folks we've heard from, more have said that than have said in favor. I just want to draw your attention to a survey that was in the Toronto Star last Saturday. 1,395 people were surveyed in Toronto and asked the body cam question, and 90% of the 1,395 were in favor, 5% were unsure, and 5% were against. Why would you think that only 5% of 1,395 people would be against when the folks we're hearing from who are speaking about body cams are generally against it? I'm just wondering how those two things stack up in your mind.
Well, I don't know that I'll respond directly to that question, because my problem is not that I think they aren't possibly in some version of the police force a tool that you could use. It's that people, the police force needs to be grasping onto that as a complete solution to the issue. And really, unless we actually change the society that we're in, unless we change the structure of the police force and of how we as a society respond to people with mental health issues, people who are not white, then what can body cams really accomplish? I'm thinking much bigger, and I think that the police force's response up to this point has been to put a Band-Aid on an enormous problem. And that's what I think body cams are. So I mean, if I'm asked a specific question about if I think they could improve it, I might say yes and be in that majority percent. But that doesn't mean that that's what I think the end result or the end goal of changing our society is. I think that lies in defunding the police.
Thank you. That answer is very helpful. Appreciate it. Board members, any other questions? Seeing none, thank you very much for taking the time out this afternoon to speak with us. We all appreciate it.
Thanks so much. Thanks.
To be next speaker.
Yes, our next speaker is Mary. Mary, can you hear us?
Hello. Hi, can you hear me?
Yes, we can. Go ahead when you're ready.
First off, I would like to thank you for the opportunity to speak here today. My name is Mary Fadalig, and I'm speaking as a concerned resident of Toronto. I'm incredibly disappointed by the City Council's vote against the proposed 10% budget cut to the Toronto Police Services, and now Mayor John Tory saying that funding for transit, homelessness services, and childcare are potentially on the chopping block to aid with the city's deficit. I find it absolutely shameful that services provided to our most vulnerable citizens are the first to go, while the police budget still stands at $1.209 billion for 2020. I am demanding, just like majority of the other speakers, for an immediate defunding, demilitarizing, and dismantling of Toronto Police Services and reallocating those funds back into our communities. There are several models in major cities in the States that have already been mentioned, particularly the Crisis Assistance Helping Out on the Streets program run by the Whitebird Clinic Social Services Center in Oregon that has seen great results over the past 30 years. I also urge you to do your own research as well, as this information is very easily accessible. Point blank, police officers are not equipped to be the first responders for calls related to mental health, homelessness, or substance abuse. They are not formally educated or trained in handling these situations, and quite frankly, lack the compassion or empathy to safely assist individuals going through crisis. The sheer presence of a police officer immediately agitates and incites fear into those who may need assistance the most, particularly our Black and Indigenous communities, who are often the target of police violence and brutality. Over the past couple of months alone, we can see just how ill-equipped the Toronto police are in handling these situations. For example, Ijaz Ahmed Chowdhury and Regis Korchinski Paquette. In both cases, the families called for assistance due to mental health related issues, and both people wound up dead after police officers arrived. Had a social services worker or mental health professional been the first one on the scene, those situations may have ended differently. The addition of body cameras is also a very poor Band-Aid solution that does not truly address the issue of policing. It is also an unacceptable excuse to add an additional $50 million to the police budget over the span of 10 years. More implicit bias or sensitivity training will not work. Police reform does not work, and it is about time that other solutions are explored if your jobs are truly here to service the community. It's time to stop throwing more money onto the problem and start genuinely caring for all of the citizens of Toronto, Black, Indigenous, LGBTQ+, homeless, elderly, disabled, and those suffering from mental health issues, and everyone else in between, and begin asking yourselves and seeking the advice of those who are especially trained in social and community services, Black Lives Matter, and other movements on what you can do to better serve all of the people of Toronto. I hope that you've been actively listening and taking notes from the other speakers over the past couple of days, and that these town halls are not simply performative or a way to appease your citizens. I hope to see real actionable changes and accountability from the board in the very near future. Thank you. I yield my time.
Thank you very much for your comments. I think you'll see us all writing notes from time to time, so we are very much actively listening. All board members are taking notice of what everyone's saying. Members, do you have any questions for the speaker? Seeing none, again, thank you very much for taking the time to call in this afternoon. We really appreciate it.
Thank you.
Please put on the next speaker, Judy.
Our next speaker is Andrea Nelson, to be followed by Brittany Telstra. Andrea, can you hear us?
Yep, can you hear me?
Yes, we can. Go ahead when ready.
So I'm Andrea Nelson, and I'm coming as a citizen of Toronto from the disability community. I also just want to mention, it was mentioned this morning, but reiterate the fact that there should definitely be an ASL interpreter at things like this, because it is not accessible to the deaf or hard of hearing community. The other points I wanted to say about body cams were definitely said in the speakers before me, so I think I will move on just to show that I'm here in support of the community's demands for immediate 50% decrease in the Toronto police budget, and for that to be reallocated to community and social services. Specifically, as a disability advocate living in Toronto, it's almost offensive how hard we have to fight for certain health and community services in this city, yet the police budget is increased again and again when there is no correlation to lower crime or an increased police budget affecting the people of the city of Toronto in a positive way, and the huge differences that have been shown and proven in increasing accessibility and health rights for those of the disability community and of every community. The last part I want to speak to is the mental health issue that has been a lot. While I myself have a physical disability, I can personally attest to the police not being equipped in regards to mental health. When I personally had to call 911 due to a friend attempting to commit suicide in my presence, when they showed up, they were definitely not equipped for a situation like this. It was quite a disaster and traumatic for me, as well as obviously my friend who was involved. And the support that we need for mental health professionals on calls like this is just, it should not even be a question. That should be a given. The police do not have training in this regard, not enough of it, and they should not be the ones going to these calls.
Thank you for sharing your stories with us. Board members, any questions? Thanks very much for calling in. We've certainly taken note of what you said this afternoon.
Thank you.
Julie, please put on the next speaker.
The next speaker is Brittany Telstra, to be followed by Julia Eden. Brittany, can you hear us?
Yep, can you hear me?
Yes, we can. Go ahead when you're ready.
Thanks. I've signed up to speak today as a citizen of Toronto. I've tried to contact my own counselor over 40 times, Annabella, with no response. Since I've submitted my original statement, several cities have decided to defund their police force, including New York, Los Angeles, San Francisco, and Minneapolis. And I just wanted to call that out before I read my submitted statement, which I'll read now.
I recently had an experience with the Toronto Police Service and urge you to honor the demands of the Black Lives Matter Toronto Defund the Police by 50% movement with a 10% minimum to start. On June 15th, I was walking north on Bathurst towards Queen Street by the Community Health Center, an area where many people who are homeless hang out and use the services there. I saw 3 uniformed armed police officers with 3 police vehicles partially blocking traffic with a man who was clearly mentally ill in handcuffs. I stopped to watch to make sure that they were treating him fairly, and when I asked what had happened, it turned out that he had stolen 2 chocolate bars and a pack of children's socks from the Shoppers Drug Mart, a crime amounting to less than $10 in damages. The items had also already been returned. The witness had decided not to press charges and left the scene right away, but the police continued to keep the man in handcuffs for an additional 30 minutes as they collected his information, claiming that he was being aggressive and refusing to speak and share his name. From what I could see, they were doing nothing to de-escalate the situation and only agitating the mentally ill man further. The police then decided to give him a $50 trespassing ticket that the man was obviously in no position to pay. I asked him to reconsider the ticket since he clearly needed help and the ticket would only cause more damage to his life than what had already been done. One of the officers then came towards me to say that I had no idea what it is to be a cop and that he must every day act as a social worker, as a psychologist, as a marriage counselor, and other roles because of the type of people that he has to deal with. And while he might feel that way, I'd like to point out that it only takes 24 weeks to become a police officer in Ontario. And by no means should any police officer consider themselves educated enough to provide mental health support or transformative support to any individual, and neither should the city. People who suffer from mental illness are 16 times more likely to be murdered by law enforcement. And I stopped because I was incredibly concerned for this man. When the police officers handed the man his ticket, they finally took off the handcuffs and left. And when I asked what I could do to help him, all he asked was for some food. Needless to say that I've been outraged by the treatment of this poor man and the other people just like him in this city. So much tax dollars go into pursuing and harassing these types of people. And I think that the cost of 1 hour of 3 officers' time, plus all of their gear, the weapons that they were carrying, and the 3 vehicles that were blocking traffic are not worth it. I don't want to pay for that. And I can tell you right now that I would prefer that money to go to feed those people, shelter those people, rather than exacerbate the issues. The answer is not more police, it's not more training, it's not more body cameras. Despite video evidence, police officers literally get away with murder and paid time off with my tax dollars. There are several studies that indicate body cams have no effect on cop behavior, and in some cases, it actually increases violence. With a grossly bloated budget of over $1 billion, I'm deeply upset. Decreasing the amount by $100 million is a minimal first step when you realize the actual size of the Toronto Police budget in comparison to how we fund paramedics, firefighters, public libraries, public housing, all of those things combined.
Thank you. I have to cut you off there. You're at 3 minutes and 40 seconds. Board members, any questions? Seeing none, again, thank you very much for taking the time to share your experiences with us this afternoon. Have a good afternoon.
Thank you.
Sylvie, please put on the next speaker.
Our next speaker is Julia Eaton, to be followed by Giori. Julia, can you hear us?
Hello, can you hear me?
Yes, we can. Go ahead when you're ready.
Hello, my name is Julia Eden, and I use she, her pronouns. I'm a resident of Toronto, and I'm in support of the complete abolition of the Toronto Police Services. We know through overwhelming and well-documented evidence that the Toronto Police are incompetent when responding to mental health crises. We know that Black and Indigenous people are far more likely to be unjustly carded, and we know of the long histories of police violence against communities of Indigenous, Black, people of color, unhoused, LGBTQ2S+, sex workers, disabled people, and otherwise marginalized people. I understand that the Toronto Police Service Board is currently undertaking a review of anti-Black racism measures in order to put forward new recommendations. So I would now like to discuss some of my master's research, which in part looked at organizational responses to racism. My research outlined the inefficacy of the kinds of internal committees that are created to respond to racism within an institution or organization. Institutions will devote time, funding, and resources to committees in order to identify solutions and recommendations that are based within diversity, anti-racism, and equity. My research showed that such committees do not work. They rarely lead to any substantive implementations, policies, or changes. Instead, they eat up time, funding, and resources. The inherent violence of policing cannot be changed by anti-racism committees, by buying body cameras, or by reforming policing practices. I demand that the Toronto Police Services surrender its enormous $1.1 billion budget in order to fund secure, long-term housing, food security programs, public transit, public health, public libraries, and community-led anti-violence programs in Toronto. By funding these areas, you will actually support Toronto residents, because when people's basic needs are met, crime decreases and there is no need for the police. You now have the opportunity for real change, and abolition is the only way forward. Thank you. I yield the remainder of my time.
Thank you for your comments. Board members, any questions? I just have one question. You mentioned you've done a lot of research. Did you send anything in to us in writing, or do you plan to?
I certainly can, but I recommend that you read such folks like Sarah Ahmed, Robin Maynard, Ruth Wilson Gilmore, and Sadia Hartman to start, but I can certainly send some extra material.
Thank you very much. We appreciate your time and effort. Have a good afternoon.
Thank you.
David, please put on the next speaker.
Our next speaker is Giori, to be followed by Ellen Fielding. Giori, can you hear us?
Yes, I can hear you.
All right, you can go ahead when you're ready.
Okay. My name is Jory DeLuca. My pronouns are she, her, and I'm a resident of Toronto and a concerned citizen. I want to argue the case for defunding the Toronto Police today. In addition to being a graduate of U of T's criminology undergrad program, I am someone who cares about justice and equal treatment for all. So when I think of the Toronto Police and the criminal justice system, I can't help but focus on the massive disparities in who we criminalize and therefore remove from society. For example, Indigenous and Black Canadians have the highest incarceration rates, and in Toronto, Black people are 20 times more likely than white people to be shot by the police. The only answer to racially biased violent policing is defunding. This is the only answer because more money equals more power in the hands of the police, like the recent decision to arm police with body cameras. These public servants don't work for the people they are paid for. They put on their uniforms with a collection of weapons and demand respect and obedience from people. They are here to protect and serve, yet the collective of police are protecting each other more than they are us. Like the concept of the in-group and out-group, the police are a brotherhood who band together to work against the very citizens who pay them. We are the out-group, their common enemy. They need something to fight against and someone to police. This is what the police are, and based on the way they treat Black and Indigenous people, this isn't working. What I'm asking for is defunding, demilitarizing, and reducing the scope of the police, like removing them from schools like the Toronto District School Board did in 2017 and a Hamilton School Board decided this June. An example asking for put into action is the Edmonton Police. Mayor Don Iveson and the council supported redirecting money from police to social services, mental health, addictions, and homelessness. In addition to Edmonton's and other cities' defunding processes, I recommend reading research by University of Toronto's Scott Wortley and Akwazi Owozu-Benpa, working with local Black and Indigenous organizations and reaching out to people living in different neighborhoods across the city and learning about what their experiences are like with the police. As a white woman, when I first read about the concept of defunding and eventually abolishing the police, I thought it was too extreme and unrealistic. But I was thinking from my own closed-minded point of view, one that has had mostly positive encounters with the police. But now defunding and abolition can be witnessed in places from Edmonton to Baltimore, and in the works of abolitionists that have come before us. There's proof of defunding being put into practice. It's no longer an impossible idea. Ultimately, what we must do is listen to people who have had different experiences with the police. Thank you for listening, but most importantly, I hope that all of this listening over the past few days and today will eventually result in prolonged action and eventually change. Thank you.
Thank you for your comments. Board members, any questions? Seeing none, again, thank you for taking the time to speak with us this afternoon. We all appreciate it.
Thank you. Bye.
Next speaker, Debbie.
Our next speaker is Ellen Fielding, to be followed by Samantha Henman. Ellen, can you hear us?
Yes, can you hear me?
Yes, we can. Go ahead when you're ready.
Okay. Hello to all the board members, and thank you for including me on this call today. My name is Ellen Fielding, and my pronouns are she and her. I'm speaking as a lifetime resident and concerned citizen of Toronto. I have also made several attempts to contact Councillor Anna Bailau with no response from her. I'm a crisis responder with the Distress Centres of Greater Toronto, and I have been in crisis many times throughout my life as well. I was extremely disturbed to hear in particular about the deaths of Regis Kurchinski-Paquette and Ajaz Ahmed Chaudhry, which happened during supposed wellness checks. I'm not claiming to know the precise details of either situation, but I do know that a wellness check should never end in death. This is unacceptable. I'm shocked at the lack of empathy displayed by Toronto Police Services. I advocate for defunding and demilitarizing their organization. I would like to share my experience being visited by police as a person experiencing a crisis. I acknowledge that I'm a white woman and I'm speaking from a place of privilege. However, if this is what privilege looks like, I worry extensively for my friends and neighbors of color, knowing how they are the ones targeted by police action first. I have had several encounters with crisis teams from both sides of the call, both responding to those in distress and being the one calling for help. One incident sticks out in particular, where I was woken up in the middle of the night, half naked, by two large uniformed men. I was asleep in bed, shaking, handcuffed, and taken against my will to CMHA to be assessed, only to be released 30 minutes later with no plans for treatment. No one from the mobile crisis intervention team was present, and being treated like a criminal in this situation compounded the depression I was already experiencing. I have to say it's a good thing I lived on the ground floor, because I would have attempted to escape that situation myself if I had a way out. Another incident occurred a few years ago when a mobile crisis intervention team member was present and was not much better. As I sat waiting to be assessed at the hospital, I got to overhear the two uniformed police officers and MCI team member talking about how no one pays them enough to deal with crisis situations. They were actively looking at job postings in the waiting room with me sitting right next to them. In a situation where I am already stripped of my dignity, I was made to feel even worse, and my mental health slid backwards. The very presence of police officers drove me to seek out even more mental health treatment that was unavailable to me. These are the two events that stick out in my mind that prompted me to become a crisis responder. The training I went through was clearly far different than that of police officers and MCI team members. I'm having a very hard time understanding why the addition of body cameras is a more worthwhile investment than mental health services. As has already been mentioned, body cameras do not help anyone but police officers, and frankly, I think they get enough. You are inadvertently creating a longer wait list for mental health care services and more traumatized individuals by sending armed police officers on mental health checks. You are directly impacting the already lacking mental health services in this city. I want to take this time to formally request that you reconsider giving the police more funds and put that money towards services that actually provide help and support to those in distress, rather than compounding fear and trauma. $50 million could go very far for community care. It's time to listen to the things that organizations such as Black Lives Matter and Not Another Black Life are proposing, and to take those to heart. Thank you.
Thank you for your comments. Board members, any questions? I just have one question. You said with the body cams, they only help police officers. Can you explain why they would only help police officers?
Because police officers have the power to turn them on and off.
What if they were required to have them on? What if they were required to have them on all the time? Then would you feel the same way?
Well, forgive me for being frank, but police officers don't always do the things required of them. So how can we trust that they would even do that?
Just as a follow-up question, if they were on all the time and guaranteed to be on, you would be okay with that then?
No, I would not. Absolutely not. It's a waste of money.
Okay. Thank you for taking your time to call in. Appreciate it. Could we please put on the next speaker?
Our next speaker is Samantha Henman, to be followed by Jesse Ledroot. Samantha, can you hear us?
Can you hear me?
Yes, we can. Go ahead.
Hi, my name is Samantha Henman, and I'm a concerned resident in Parkdale High Park. I love this city, but I hate to see what the current iteration of Toronto Police Services is doing to it. I work for an online publisher that produces lists of facts. So yes, I spend my days doing research to come up with sentences like, did you know that eggplants contain nicotine? So to begin, I'd like to foreground the conversation with two undeniable facts that you already know and that are tied together. Fact one, Toronto Police Services has a yearly budget of $1.1 billion, more than what is given to libraries, housing, and shelters combined. Fact two, Black people in Toronto are victimized by the very police services you sit on the board for at a disproportionately high rate. From my viewpoint as a citizen, there's only one conclusion to be drawn by thinking of these two facts together. The Toronto Police Service takes our tax money and uses it to hurt, maim, and kill Black people in Toronto. There are many ways to remedy the damage that has been done, but the most immediate way would be to defund the police by 50%. We've seen a serious economic downturn since the beginning of the pandemic, and things are only going to get worse, which is why it is crucial for you to act immediately and push to redistribute 50% of the police budget to protect our communities from further harm. Here are some things that the police board can cut in order to redirect the inflated budget. Remove cops in schools, remove all weaponry from police forces, end mass surveillance, eliminate policing patrols, especially in vulnerable communities, end police response to bylaw infractions and mental health crises, end police suspensions with pay. These completely unnecessary initiatives eat up our tax money and give nothing back to the community. By cutting the police budget by 50%, resources can be redirected towards investing in secure, long-term housing for those in need, food security programs, public transit, public health, public libraries, and community-led anti-violence programs. The motto of the Toronto Police Services is to serve and protect. Based on recent events like the unnecessary use of pepper spray at the small, nonviolent protest of the mayor's condo, the tragic death of Rejos Korshinsky-Paquette, or the murder of Ijaz Ahmad Chowdhury at the hands of the police, one thing has been made obvious. It is clear that the Toronto Police Service only operates to serve and protect first themselves, and then private property, corporations, and the wealthy and powerful. This is unacceptable, and I worry every day for my neighbors in the community. If there has to be a police service, I want to see it serve and protect the most vulnerable people in Toronto. To do this, we must start by defunding the police. I'd like to conclude by addressing your function as the Police Services Board directly. The function of the Police Services Board, according to the Government of Canada, is to contribute to their community's safety and well-being by working with local citizens and organizations to ensure their community receives the appropriate policing it needs. Based on the statistics about racist police violence that you've heard repeatedly over the course of these town halls, I want you all to think about how deeply you've failed your community thus far. It is something to be ashamed of, but you have an opportunity to make a change and make things better. Please take it. Thank you for your time.
Thank you for your comments. Board members, any questions of the speaker? Seeing none, again, thank you very much for taking the time to talk to us this afternoon. We all appreciate it.
Thank you.
Do we next speaker?
Our next speaker is Jesse, to be followed by Greg Houston. Jesse, can you hear us?
Can you hear me?
Yes, we can. Go ahead when you're ready.
Okay. So first, I just wanted to make a bit of a statement regarding the opening land acknowledgement. I found it sort of interesting that this session commenced with a land acknowledgement when just this week Mayor Tory has spoken of a need to cut essential services to at-risk people due to budget shortfalls as a result of COVID-19. It's the sort of glad handing that actually comes off as insulting to Indigenous people who are largely affected by disproportionate violence from the police, to think that a land acknowledgement in lieu of actual concrete steps to protect those people, it just comes off as tone deaf. So anyways, my name is Jesse, and I've lived in this city for almost 20 years. And I have some questions, I suppose. My first question is, how can we as citizens trust our elected officials to represent the interests of their constituents when, after having requested a very minor adjustment to an obviously absurd and inflated police budget, and then to be met with a response of an increase to the budget for body cameras and talk of austerity from Mayor Tory himself? Even we know definitively that investment in social programs eventually prevents crime. One thing that studies also show is that body cams increase the number of arrests officers make while wearing them. Is this proof of their efficacy, or are they simply another means to justify endless inflation of an already obscene police budget? Any other potential benefits of body cams are still up for debate statistically, especially given that I don't trust the Toronto Police Union to release all potentially incriminating material in good faith. So given this understanding and the legislative response received to our justifiable outrage, how can we trust our elected officials and by extension, the Toronto Police Service to do the right thing if this is the type of response we get to a global outcry from people sick and tired of seeing at-risk people abused and killed by police because they are not equipped to deal with people in crisis without resorting to violence? I yield my time. Thank you.
Thank you very much for your comments. Board members, any questions? Again, thank you for taking the time to speak with us this afternoon. We really appreciate it.
Thank you for listening.
Next speaker, Doobie.
Our next speaker is Greg Houston, to be followed by Casey. Greg, can you hear us?
Yeah, I can hear you.
Go ahead when you're ready.
Okay. Thanks for having me today. I've followed along with the town hall thus far, and I'm taking notes, and I hope the heck you are too. Please stop asking deputants to do the research for you. This is why you were elected or placed on this board. This is your job to find the solutions. Body cameras are a toothless response to a systemic problem of police policing the police. Police do not deserve a union, and they do not deserve to be as overfunded as they are. We're asking too much of general officers without de-escalation and mental health training. In May 2018, the Toronto Police College and the Toronto Beyond the Blue brought Dave Grossman to lecture here. If you don't know him, Google him. He created Killology, and he is one of the leading factors of the mental militarization of policing across North America. This is what people mean when they say policing is institutionally racist and messed up. Obviously, defund, dismantle, and disband the police, but like climate change, this is a generational event, and we need to start with immediate actions like reducing the TPS budget 10 to 50%, moving that money to housing, outreach programs, food banks, and mental health response teams. 95% of the radicalized people murdered by police brutality were experiencing trauma or mental health crisis due to losing housing or losing a job. If you fix those issues, crises won't happen. On June 15th, City Council shamelessly voted with landlords and developers against future tenants to allow rent increases 2% above the provincial guidelines in the Housing Now programs. These are the kinds of actions that put people on the street and prey to the police. I could tell you some genuine stories of having to call the police during friends and loved ones' mental health crises and how slow response times were, how they couldn't handle the situation, how they did nothing or didn't believe victims. But instead, I'd rather just say, why do we even have police? Police in Canada were created not even 200 years ago based on England's Metropolitan Police Act, except we insisted on including guns. Police were created to protect property and break up unions, and they do not prevent crime, they do not solve crime. The merchant class used to pay for it all, and then they made the city pay for it via taxation. We have survived as humans in society for 60,000 years, and have had police for 200. We got it wrong. This is a failed experiment, killing Black and Indigenous peoples at an exponential rate. I cede the rest of my time.
Thank you for your comments. Board members, any questions of the speaker? Seeing none, again, thank you for spending time with us this afternoon. We really appreciate it.
Thanks.
Doobie, next speaker.
Our next speaker is Casey, to be followed by Allison Habistro. Casey, can you hear us? Oh, seem to have lost Casey. Allison, can you hear us?
Yes, I can hear you.
All right, and you'll be followed by Amaya Sullivan. Go ahead when you're ready.
Cool. I just wanted to start by saying there's been a lot of talk about the body cameras and accountability. I just want to say that Josh Matlow did try to present a recommendation, number 13 in the report, to ensure consequences for unauthorization deactivation of covering the cameras. No was voted for 18 times. Yes was voted for 6 times. It lost, and our mayor was one of the people who voted against consequences. Simply have a few questions now. I know you can't answer them, but I hope you'll meditate on them. When you were a kid, what made you want to work for the people? Who did you want to protect? What would the child version of yourself think of the person that you are today and the actions that you're taking? Is it enough? Would they be proud? What would you think of the protest? The demand for your job now as an adult to simply do what is in your power to do and stop the killing and brutalization of innocent Black people, Indigenous people, people with mental illness, The demand is simply put funding into taking care of the people who need it most. My last question is, who are you protecting now? Who are the police protecting now? Black people, Indigenous people, people with mental illness, people who've been oppressed for generations by a system that deems them disposable. These are the people paying the salaries of the Toronto Police. Regis Korchinski-Paquette, Ajaz Ahmed Chaudhry, Albert Johnson, Lester Donaldson, Dominic Sabatino, Albert Moses, Wayne Williams, Otto Vass, Nicholas Lentis, Jeffrey Rodica, Dwayne Christian, Byron DeBassige, Rael Jardine-Douglas, Ian Price, Andrew Loku, Sandra Conville paid the officers that ended their lives. Their families pay them now. Their children will continue to pay their salaries and yours. So why aren't you fighting tooth and nail for them? The rich elite that the city time and time again prioritizes does not need your protection. It's time to start working for and with the people that do. If you aren't protecting our most vulnerable, what is the point? You need to ask yourself why the city is not expediting working with Operation Prefrontal Cortex or a Kahoot-style system of policing, a system that overwhelmingly works for the people, works to protect your officers, and if none of that matters to you, it saves millions of dollars a year for the police department. In 1 year alone in Eugene, Oregon, only 150 of 24,000 mental health-related emergency calls needed police backup. These calls make up 20% of all 911 calls, and their budget was less than 3% of the police. How many of the people I listed would still be alive if this system were in place instead of statistically unequipped and undertrained officers? The escalation does not mean murder. I asked the board how many lives is the City of Toronto willing to lose? How many lives is too many before we start seeing real change? I yield my time.
Thank you for your comments. Board members, any questions? Again, thank you for spending time with us this afternoon and giving us your points. Appreciate it. Next speaker, Judy.
We have Casey back on the line. Casey, can you hear us?
Yeah, can you hear me?
Yes, we can. Go ahead when you're ready.
Okay. My name is Casey Devios, and I am a Toronto resident. My husband and I have chosen to invest in the city. We got our home here. We're building our careers here, raising our 2 young daughters here. However, as a white woman with a white partner raising 2 white children, I realize my experience in the city is not reflective of all. The diversity that I admire most about Toronto represents the most marginalized communities. And although I was proud to support my city councillor, Josh Matlow, and Councillor Kristen Montan, who proposed to defund the Toronto police budget by 10% and invest into these communities, I do not believe 10% was enough. I am here echoing the calls of the Black Lives Matter movement and so many who have already spoken. I demand you immediately redirect a minimum of 50% of the $1.1 billion Toronto Police Service budget and invest the money into communities. Start by lifting up the most marginalized populations, by investing in areas like long-term housing solutions, food and security programs, public transit, public libraries, community-led anti-violence programs, child care, education, health, and mental health crisis support. As a taxpayer, I am deeply concerned at the amount of my tax money that is going to the Toronto Police Service, especially now as John Tory and the City Council passed a $50 million increase in police budget for body cameras over the next 10 years, a tactic proven not to decrease police violence. And he is now begging the federal government for money, threatening to cut funding to essential services like transportation and childcare and protection of the homeless populations. The inflated TPS budget is stealing money from the community. As a citizen, I am just as concerned at the lack of accountability within the Toronto Police Service. For an organization that's role is to serve and protect, you are failing. The fact is, Black people are 20 times more likely to be shot dead by police in Toronto than white residents, despite the fact that Black people make up only 10% of the city's population, while white people make up 50%. I'm not here to debate racism in the TPS. The people who have shared their very real experiences of racial discrimination and violence at the hands of the TPS in this town hall and for years are not debatable. The lived experience of the BIPOC communities are facts. There are countless victims of recent police violence in our community. Devontae Miller, Regis Korchinski-Paquette, Eshaz Chandri, Andrew Loku, Sammy Yati, and the list goes on. Listening to the BIPOC communities is how we will find creative solutions. As a mother, I cannot help but feel responsible for the safety of all the children, not just my own. And that is why I support defunding the police. I encourage you to listen to the overwhelming cries of the citizens of Toronto and work with the organizations and the leaders and the cities who have already done the work in offering the fact-based and proven solution. Thank you. I yield my time.
Chair Hart seem to be muted.
Hello?
Well, thank you very much for taking the time this afternoon to speak with us. Have a good afternoon, and we appreciate your viewpoints.
Thanks.
Next speaker.
Our next speaker is Amaya Sullivan, to be followed by Miroslav Glavic. Amaya, can you hear us?
Yeah, I can. Can you hear me?
Yes, we can. Go ahead when you're ready.
Okay, great. Good afternoon. I just wanted to start off by saying that I've been watching pretty much 90% of these town hall videos, and I'm incredibly hurt by Francis Nutitsa, the fact that you're not paying attention to what's going on. Like, you could totally just turn your camera off. If you don't want to be visible, then you don't have to look at the camera, but you're spending so much of your time looking away from the screen, and it just feels just really hurtful. Secondly, I wanted to point back to a previous caller named Jesse had pointed out that the land acknowledgement at the beginning of this talk, although I'm sure it has good intentions, it seems incredibly dishonest in comparison to what we're talking about and what we're asking from you. It just seems ingenuine. We're asking to defund the police because of the way Black and Indigenous people are treated in our town and in our country. And if you can acknowledge that we're on their land, how can you not acknowledge that you're hurting them and killing them at rates that are insanely high and need to be stopped immediately? If we can't come to an agreement that that is just wrong, then I can't even fathom understanding how you guys are all sitting here today showing almost no emotion to the fact that in Toronto alone, like previous speaker Casey just said, Black people are 20 times more likely to be fatally shot by Toronto police. And in the correction sheet said 10%, they're actually only 8.8% of Toronto's population. I think the thousands of emails that people have been sending for the past few months, maybe it's been weeks, say enough that we need the police to be defunded and we need a system put in place that is not police showing up to emergency mental health things. Also super disappointed that John Tory is not here today. I think that's pretty crazy. And that's pretty much all I have to say. I think it's just like, it seems like everyone is super tone deaf in this meeting. Like, I don't understand where people aren't listening and why there's almost no sympathy. I yield my time. Thanks.
Thank you for your comments. I can assure you we're listening and taking notes, and we have staff in the background as well taking notes, so that when we report out on August the 18th to our board, we can have as an attachment the outcome of these 4 town halls and all we heard from everyone who called in. So I can tell you that all board members feel that everyone's comments are valued.
Mr. Chairman, if I'd just like to make a comment. First of all,
Nunziata, go right ahead.
Yes, it's Councillor Nunziata. I've been sitting through all 3 meetings and I've been listening. And if I walk away from my screen to get some paper on my desk, but we are definitely listening. All of us are listening. All the board members are listening.
I appreciate you saying that, but truthfully, I've watched almost 95% of them, and you look like you're not listening at all. Or, I don't know, like you're half on the screen, half off the screen, and you don't seem that engaged. And that's what I'm seeing from comments online as well, is that people are saying that you should be paying more attention, at least make it look like you are.
Board members, any questions of the speaker?
No, I don't need to respond to that.
Thank you. Thank you for calling in. Enjoy the rest of your afternoon.
Thank you. Bye-bye.
To be next speaker.
Hello, can you hear me?
Our next speaker is Miroslav Glavic. Miroslav, can you hear us?
Can you hear me?
Yes, we can. Go ahead when you're ready.
Okay, 3 minutes. One of the main issues, if any of you have been hearing, which all the evidence is, one of the problems is that a lot of the police, not every officer, I'm not painting every police officer in the same brush or whatever the expression is, they're incapable of change or accepting when they make a mistake. One of the examples, one of the interactions I'm hard of hearing, I asked the officers to write things down. I can't hear you. It happens constantly. No apology. They said no apology. Another example is one of my staff was closing my store in North Etobicoke. She got stopped. She got stopped, and there was mentioned to this day no apology. The disability community, when they interact with the police, they always ask to accommodate. That rarely happens. And to this day, many officers, they treat a lot of the people in the disability community, including me, like we're some kind of guilty criminal. And when I make a mistake, I apologize. You know, a lot of these people that have spoken before, none of you have said a single "I am sorry" or whatever apology. You know, a lot of the people here don't believe nothing's going to change. And the last thing one of you said about I'm against those cameras, warm body worn cameras. One of you mentioned a poll of, I think it was the Toronto Star, that said 1,300 and something. There's 3-point-something million people in the city. That poll does not represent the truth feeling of the people of Toronto that pay your salaries. That is all. Thank you.
Thank you, Miroslav, for calling in. Board members, any questions? Seeing none, again, thank you for taking the time to talk to us today. We appreciate it. To be next speaker.
We have one more caller. I didn't get a chance to identify them before we started. So, number 416559. Caller, can you identify yourself, please?
Hi, good afternoon. My name is Stacy. Can you hear me?
Yes, we can. Go ahead when you're ready.
Hi. Thank you. So I'm speaking to you today as a born and raised Torontonian, as a provincial youth outreach worker who has had many occasions to work very closely with officers in needs improvement communities, as well as having a close family friend who is an officer. I find myself feeling a great deal of frustration and some empathy when I think about our police services. My frustration comes from years of debriefing negative and sometimes traumatic police interactions that many of my marginalized and specifically racialized youth have experienced, on top of witnessing several myself. This is deeply frustrating to see, as in any other profession where a person is expected to interact with the public, that employee would be given training and guidelines as to how to approach, speak to, and even build rapport with those people they serve. Maybe even some de-escalation techniques were appropriate. It concerns me that too many of the examples which I've been exposed to would suggest that officers are either not being trained adequately in this regard or are being trained to intimidate rather than to build trust. As the father of modern policing, Sir Robert Peel, said way back in 1829, the police are the public and the public are the police. Therefore, any officer should be a part of their community, not an outsider coming to act as an authority figure to strangers. Along with the thought of training, I feel empathy for the officers who are being sent in to address situations which they clearly have not been given the appropriate training for, be it culturally, socially, or even just basic verbal tools. And they are being held accountable for this in the public forum. I've heard it said in previous meetings and by other speakers, and I truly believe that expanding our emergency response systems to include culturally relevant mental health services as part of our first responders is not only smart, but a truly ethical move. Not only would it greatly benefit all of the citizens of this city through appropriate response and prevention, as well as potential job creation for properly trained mental health workers, but it would set a wonderful example of a commitment to progress and ethical and fair treatment of all our citizens for everyone else to see. Thank you very much for listening. I yield the rest of my time.
Thank you very much for your comments. Board members, any questions? I just have one of you. You said you've had a number of interactions with police in your work environment. Is that correct?
Yes, so I am a provincial youth outreach worker. So I work with youth who are, at risk and are considered marginalized. And many of them have stories about situations where they've had really negative interactions with the police. And I personally actually grew up in a needs improvement area, so I was exposed to some pretty interesting interactions myself, either personally or through people I know.
Have you seen any positive interactions, or is it all as your experience? Yes. Or okay.
Absolutely, I have, and that's why I'm very hopeful about the idea that, with a restructuring or even defunding of the police and them focusing on their job in a different way, that they could have positive interactions and, be that community friend that we're all taught or told police are when we're in elementary school.
That's great. I appreciate hearing that balanced approach. Thank you very much. Any questions, board members? No. Okay, thank you very much for taking the time to be with us this afternoon. We appreciate your thoughts. Doobie, are there any other speakers, or was that the last one?
That was the last one on our list.
Okay, board members, any comments before I wrap up? Anyone listening, I just want to thank everybody for calling in today and taking the time. I can assure you that your board members are listening to everything that you say. And not only are the board members listening, we have staff in the background taking extensive notes, which you will see captured in our August the 18th board report. So again, thank you, everyone. We will be having another session tomorrow. Have a good evening. Bye for now.